Hi class, welcome back. We are still looking at the heart. So let's take a look at the heart and look at some of these blood vessels from the superficial portion. So when we're looking at the heart superficially, now here we could see the superior vena cava. Remember, that's bringing deoxygenated blood into the right atrium. This little flap right here that looks like a dog's ear, that little flap is a reservoir. They call it an auricle. There's a right auricle and you can see on this side right here, a left auricle. Okay. All right, but in general, we have the right atrium on the bottom. We have the right ventricle. On the left-hand side, left atrium, left ventricle. We had a superior vena cava on the top, and on the bottom we have an inferior vena cava. Again, both of those are two main blood vessels. They're going to find a way to bring deoxygenated blood into the right atrium. The third vessel is one of the heart itself that was called the coronary sinus. That's going to bring deoxygenated blood from the heart itself into the right atrium. Okay, now we can't see any of the valves here because we're not looking at the heart on the inside. We're just looking at it superficially. Here is the aorta. This part of it is the arc or the arch of the aorta. And again, we have 1, 2, 3 main blood vessels coming off of the arch of the aorta. Number 1 is going to go to the right side of the body, and number 2 and 3 go to the left-hand side. Again, number 1 is called the brachiocephalic artery. Number 2 is the left common carotid artery. Number 3 is called the left subclavian artery. This arch of the aorta starts to descend, and once it starts to curve down, they call it the descending aorta. And when it's in the thoracic region, sometimes the descending aorta is also called the thoracic aorta. The descending aorta is also called the thoracic aorta. When it goes below the diaphragm, if this down here is the diaphragm, that blood vessel continues, then they call it the abdominal aorta. It's just a continuation of this large thing as it goes down. Okay, we can see the pulmonary artery carrying deoxygenated blood. And really the pulmonary artery, it's a little, I'm going to shorten this arrow. This is a pulmonary artery because this here, that's your pulmonary trunk, right? Off the tree trunk are the branches. So pulmonary trunk, pulmonary artery. So this is the left pulmonary artery, and over here, right there, that's the right pulmonary artery. Arteries carry blood away from the heart. Here's the pulmonary veins, bringing blood back to the left atrium, and over here, that's the right pulmonary vein, bringing oxygenated blood into the left atrium. And over here, off the aorta, right there, that is a major blood vessel bringing oxygen to the myocardium of the heart. That's called the right coronary artery. Okay. Now, from the back view, from the posterior view, right? We're looking at the heart from the back, so you can see the arch of the aorta right here. We can see number 1, number 2, and number 3. Now we're just looking at it backwards. So there's the brachiocephalic artery, the left common carotid, and the left subclavian. This was number 1, number 2, and number 3, just from the posterior view. We see on the bottom, posterior external view. After the arch of the aorta, right there, that's the descending aorta. And then it continues down. Here's the superior vena cava. Here's the inferior vena cava. Now there's one other blood vessel. Now remember, the superior vena cava and inferior vena cava are going to bring blood right to the right atrium. Now we have veins of the heart as well, and those veins are going to dump into this coronary sinus right here, and that leads to the back of the right atrium. So deoxygenated blood from the heart muscle itself goes into the right atrium, blood from the superior vena cava and blood from the inferior vena cava all dumping into the right atrium. Okay. Okay, what else do we have back here? We see a middle cardiac vein right here. We see the right ventricle on the posterior and the left ventricle from the posterior. So the right atrium receives blood from the superior vena cava, the inferior vena cava, and the coronary sinus. The right ventricle, right? So we went over how blood ends up here in the right atrium. Now, how does blood end up here in the right ventricle? So the right ventricle receives blood from the right atrium. And then what? Then it's going to send the blood where? To the lungs. How is it going to send it to the lungs? Well, it's got to go up this way in the pulmonary trunk. It's going to force the pulmonary semilunar valves open. So in terms of valves, there are atrial ventricular valves, and then there are semilunar valves. And there are 2 atrial ventricular valves, and there are 2 semilunars. Atrial ventricular just means the valves between the atrium and the ventricle. So on the right side, that would be the tricuspid, and on the left-hand side, that's going to be the bicuspid valve, aka mitral valve. So those are the AV valves, the AV valves. The semilunar valves, that's going to be this one here, the pulmonary semilunar, this one, pulmonary valve, it's the pulmonary semilunar. And then the other is the aortic semilunar, the aortic semilunar, which we can see a little bit right there. It's called the aortic valve, but it's the aortic semilunar. It's going to force blood that way. Well, how's the left atrium going to receive blood? It's going to receive blood from both the left and the right pulmonary veins, oxygenated blood, because it's leaving the lungs. Well, the left ventricle is going to receive blood from the left ventricle receives blood from the left atrium, and after the atrium pumps blood to the ventricle, when that pressure builds and builds and builds, it's going to push it through the aortic semilunar into the arch of the aorta, and it's going to find a way to pump blood all over the body, which is why this musculature right here is so thick. If we do a cross section this way and we look at a bird's eye view looking this way, this is the left ventricle, this is the right ventricle. Look at the difference of the size of the musculature here. This is the myocardium. Much thicker on the left ventricle side. Have you ever heard of myocarditis? A lot of people dealing with myocarditis, which is inflammation of this musculature. With this muscle, if this muscle thickens even more than what it is, the lumen gets much, much smaller. So the heart has to beat so much stronger and so much faster to eject the same amount of blood. If one heart contraction can eject blood out that's of normal size, but now this is 1/4 of the size, this has to beat 4 times as fast. When it's beating much faster, they call it tachycardia. Tachycardia means a fast, rapid heart rate. And then you're breathing quicker. You're breathing faster to keep up with the pace that the blood is sending it in. The deoxygenated blood goes into the lungs, so you have to breathe quicker to oxygenate it. Okay, so now, why is the left ventricle musculature thicker than the right ventricle? It's because the left has to pump blood hard enough to eject it to the upper extremity, the lower extremity, the hands, the fingers, the toes, all of the organs, including the head and the brain. Whereas the right side is much thinner because it really only has to pump blood where? To the lungs. So the left side is called systemic circulation, pumping it to all the systems of the body. And the right side is called pulmonary circulation, simply just pumping blood to the lungs. Okay, so we understand the valves. We know what the atrioventricular valves are. Those are going to be the tricuspid and bicuspid. And we know what the semilunar valves are. That's going to be the pulmonary semilunar valve and the aortic semilunar valve. And this is where they are here. When one set of valves are open, the other set is closed. So when you look here on the right-hand side, we see the bicuspid and the tricuspid is closed, but we can see the semilunars, the pulmonary semilunar and aortic semilunar, these are both open. When this shuts, this is lub. And then on the left-hand side, we see the pulmonary semilunar closed, and we say the aortic semilunar closed, but the AV valves are open. When the semilunars close, that's dub. So you get lub dub, lub dub, lub dub. You only hear the closure of the valves. Okay, so I put this picture here again just as a quick overview. Now that we kind of been through it a few times, blood comes into the right atrium from the superior and inferior vena cava, as well as the coronary sinus. So we see number 1, number 2, and number 3. Those 3 main areas are pumping blood into the right atrium. When the pectinate muscles contract, they push blood through the tricuspid valve into the right ventricle. When the right ventricular pressure builds, the ventricles contract along with the trabecular carne muscles down here. They contract from inferior to superior, which shuts the tricuspid valve and forces the pulmonary semilunar open, pumping blood into the pulmonary trunk, into the left and right pulmonary arteries. Now the blood, the deoxygenated blood is in the lungs. We breathe in oxygen. The red blood cells become oxygenated. It's going to bring the oxygenated blood via the pulmonary veins into the left atrium. The pressure in the left atrium builds and builds and builds. The pectinate muscles and gravity push blood from superior to inferior, pumping the blood into the left ventricle. The left ventricular pressure builds and builds and builds. Then the left ventricle pumps blood inferior to superior, shutting the bicuspid valve, aka mitral valve, but forcing the aortic semilunar open, forcing oxygenated blood into the arch of the aorta, pushing blood into the brachiocephalic, the left common carotid artery, and the left subclavian artery. Now it's arching down to the descending aorta, aka thoracic aorta, down into the abdominal aorta once it's inferior to the diaphragm. Okay, good place to take our break. When we come back, we'll talk about the different layers of the heart.